Good. All right. Okay. I wonder if you can. Hello. Can you all hear us? Okay, perfect. Well, thank you guys for joining us tonight. My name is Cori Stutz. I'm a silver wellness advocate. I've been using doTERRA essential oils for about 2.5 years now, and sharing them as much as I can. It's become a passion of mine, and I'm so glad and fortunate to be able to work with Rhonda. She has been a pinnacle force in helping us introduce these essential oils into the hospital setting. Not only is she my best friend's mother, but it's been such a joy to work with her. So Rhonda's going to kind of just lead this webinar for you guys tonight, since she's in the hospital setting every day, and I'll let her introduce herself.
Sure. I'm happy to be here with you guys tonight. It sounds like there was a lot of questions going on about how to get doTERRA essential oils into a healthcare setting. And I'm a registered nurse. I've been a registered nurse for almost 31 years now. I'm a chief nursing officer in a critical access hospital in Ellensburg, Washington. And my hospital, I think, has a lot of doTERRA users. And so Cori and I wanted to really share with you tonight how we were able to sort of introduce doTERRA into the healthcare setting and get that into the hands of people that many of you are wanting to reach out to as well.
So I think we're gonna just kind of go through, there was a large list of questions that you guys submitted, and we're just going to kind of loosely go off of that list of questions. They were really great questions, and again, we just appreciate you guys for joining and you know, being so interested in really the force that's going to help doTERRA break through into the healthcare field, making more and more people, making it available to more and more people. So I guess one of the best ways to start, you know, is how did we begin sharing with people at our local hospital? So,
okay. Well, I think that Cori had introduced me to the oils probably about 1.5 years ago. And, you know, like everyone else, I saw the benefit for me and I saw the benefit for my family. And the oils really do sell themselves. And I think that that's something that you have to remember, even working with healthcare professionals, is to really reach out like Cori does. The thing I love about Cori, she reaches out with her heart. And she really is a wonderful person to share the oils with. And I think that that's really how things began for us in my workplace. Being around people who were sick, coming to work sick, just like they do in every other business or profession. Your coworkers have a cold, they have a migraine headache, they are getting the flu right and left, and they're just not healthy or feeling well. And I always have, you know, my personal little stash of essential oils that I keep with me. And I have a diffuser And so when people weren't feeling well, I would do what all of you do, is say, I have an oil for that. Would you like to try it? And they would. And I know many people had concerns about solicitation in the workplace, and certainly my workplace is no different. You know, we can't sell Mary Kay or Tupperware. We have to be very careful about those types of things. But in this instance, it really was, to me, was no different than sharing an aspirin with a coworker who said they had a headache, or an ibuprofen. And instead of sharing an aspirin or ibuprofen, I would be offering them some frankincense. And I would be sure to tell them how to use it. And I would be sure to offer them a sample that they could take home with them, and hopefully that they would feel better. And invariably, these people would come back to me wanting to know more about the oils. And instead of me then trying to talk to them about doTERRA in the workplace, I was able to utilize my upline, Cori, and the rest of our team. My daughter is also my upline. and Cori and Lindsay, my daughter, would reach out and have classes with a lot of these coworkers of mine. And that was a wonderful way for it to spread within our workplace.
It was, and it's a great way, you know, always inviting people to your classes, making sure that that pressure is off of them if they are someone who sort of answers to an administrator or something like that in their hospital, if that's the person sharing with them, like you, that they don't feel, well, I have to do this because this is my boss. Yeah.
And also, you know, as the boss, I don't want to know about people's personal health care concerns, and I don't want them to ever feel intimidated by that. So it was really nice for me to sort of be able to step out of the picture and then have their wellness consult be with someone other than myself. So I think that that worked very well. And Cori has a sample of a loaner bag. I think she has a picture of that. I don't know if you want to show that, but she was able to put together a wonderful loaner bag that then she could share with various people throughout the organization. If you want to talk about the contents and how you use that.
So the loaner bag is a really great way, because people have asked on these questions, how do you sample out to healthcare professionals? How do you get these oils in their offices? A great way is a loaner bag. And most of these people I know on a personal level or have been introduced to them through Rhonda. And so I have established a relationship. It isn't just sort of like a cold call where I just pop into the office and say, oh, here, would you like to try these oils? It's more of a personal thing, but I always want to be sure that the loaner bag is available. And so a loaner bag is a really great thing, as you can see on the picture, but it just comes in this nice tote bag. And inside of there is always my favorite diffuser, a petal diffuser for them to try, a keychain full of samples that I feel are personalized for them or their healthcare setting. If it's, you know, an office, whether it's on the administrative side or, you know, a welcome desk at a hospital, I always make sure there's some On Guard and maybe you know, some peace or elevation. Always fractionated coconut oil is in there. We always make sure that there's an A to Z guide, a copy of the updated Modern Essentials. Healthy Can Be Simple. There's always a few extra copies of these so that they can hand them out to anyone who asks questions. There's always an updated copy of the Living magazine. I like to keep the Deep Blue samples, On Guard toothpaste, and lots of extra samples for them to share while they have the loaner bag. We use a lot of the tear sheets, obviously, that these ones are really great. These are the essential oils in the workplace. And this is a great one for exactly what we're talking about. Mm-hmm. This one's almost gone. You can tell I share this a lot. And I really just love this because not only is it talking about wellness, but there's a study on the back that talks about stress in the workplace. You can see that. And so that's a tear sheet that I use all the time. It's wellness in the workplace, and you can get that off of Aroma Tools. The way that the loaner bag works is that I just tell them, like, hey, you get to have this bag for a week. You can use it here at work. You can take it home. And I always make sure that in there is a calendar with upcoming classes. And I always just make sure that they know that they can contact me any time of day or night with questions. And the loaner bag is a really great hit. it doesn't cost that much to put it together. And so many contacts have come from that, not just from me sharing it with one particular person, but them sharing it with others in their lives and in their workplace.
Other things that we have done is we have a Christmas bazaar, and so you're able to sell handmade items at your Christmas bazaar. And so this year we had a doTERRA table, and rather than just having the essential oils there because they're not homemade gifts, we or Cori and Lindsay had roller balls, the make and take roller balls, and then they had different products. I know they had probably some hand sanitizer, which is really going to be popular with healthcare professionals, and then just different types of body balms. And you even did some Play-Doh that was scented, like an aromatherapy Play-Doh that was really great for kids for Christmas. So some of those things were ways to get into the hospital. And just, of course, if anybody wanted to know more about the oils, they could book a party after that, or we could do a wellness consult right there on the spot and even have a make and take rollerball designed specifically for them during that event. Other ways that we're getting into the hospital is coming up very soon in May is Nurses Practice Week, Nurse Appreciation Week. And that's a national recognition for nursing. And I have asked various AromaTouch certified leaders to come in and give AromaTouch massages to the nursing staff. And I'm hopeful that we're going to be able to pull this off and really recognize our nurses for the wonderful work that they do and give them a brief opportunity to step aside from the workplace and reduce some stress. And whether we do hand massages or foot massages or just a full AromaTouch technique on them, they will so appreciate that. And then we can also do a wellness consult. And it's a way to introduce the oils without selling them there or soliciting. But then if they want to know more information, they could either book a party or contact whoever will be there for more information. There's always some week in the healthcare professions that someone is being recognized, whether it's the radiology staff or the lab staff. There's always something for you to find your way in the door. And I think some of the questions that we had related to, how do you really get your foot in the door if you're not working in a healthcare setting? And I think that the first thing is relationships with anyone that is working in the hospital. First of all, establish those relationships and introduce them to doTERRA, and that can be your best way to get in. If you were doing cold calls, which I think would be probably pretty hard. Physicians really relate to physicians. So unless you have a physician who is making a recommendation for the oils, I think that would be very difficult. But other avenues would be working with the human resources department, because a lot of hospitals are actually self-insured these days and offer their own insurance product to their employees, and many of those actually include alternative therapies. So it's becoming more and more common to offer massage therapy as a health insurance benefit, or to offer acupuncture, or to offer aromatherapy. And I would approach that as a way to reduce stress within their staff, just like a massage would, and see if they would include that as a healthcare benefit. We had some questions about, could a physician write a prescription for an essential oil? And certainly, obviously, they could. They can write a prescription for Tylenol or ibuprofen or anything available over the counter. I think the bigger question is, who's going to pay for that? So that's why I'm saying you would really want to get in touch with the insurance companies to see whether or not that would be a benefit that they would offer in their organization. And if it is, I would think that they would want that to come from a certified AromaTouch therapist as opposed to a wellness advocate. So I'm not sure that that's the best angle to go about selling the oils personally. There are a lot of research articles on PubMed, and I think if you're sharing with physicians or professional staff, that's a wonderful way to give them that type of research and literature, just like the Vanderbilt study. That's fabulous. Most hospitals would have a nurse practice committee, and I would probably want to reach out to the chief nursing officer and say, do you have a nurse practice committee, and would you be interested in learning about the research around essential oils and reducing stress in the workplace, and offer to come maybe to a nurse practice committee meeting and share the Vanderbilt study and some of the great research behind using essential oils in the workplace to reduce stress. I think that that would be a wonderful way to target that.
I agree. And you meant a certified aromatherapist,
oh, yes,
right?
certified
Okay.
aromatherapist.
Yeah, just to clarify.
Thank you.
An aromatouch person will be great to work with the hospital also, but
Right.
A certified aromatherapist. So when we're talking about, cold calling and things like that, like I've never really gone down that route. I've always tried to establish a personal relationship with someone, whether it's in the clinic setting, whether it's, a chiropractor or a massage therapist that someone in my family sees. I've always tried to start on a personal relationship level instead of just cold calling. And some of you might be really comfortable with doing that. I just have not been. I always try and start out with, building a relationship and letting them see that it's a passion of mine, these oils, that I value them and what they're doing for my family's health and wellness. And, Rhonda and I were saying this just before the webinar, and we say it all the time, that the oils really sell themselves. So if you're using them and you truly are a wellness advocate, people in your workplace, people in your community, people who come to your classes, they're going to see that. And that's a really great way to start sharing, right? So if you were to do something like a cold call, or, reach out by way of letter or email or something like that, just make it as personal as you can. And I would really suggest that rather than saying, how can I sell you these essential oils or anything like that? Well, how can I share these with you? That's the best way. So sharing is really the best way to get the oils out there. An example was a chiropractor that my husband was seeing. His wife was in a similar like baby and mama type of a class with my children and I. And so I met her and I just started sharing oils with her and how well they are working for my family. And she started using them as well. And then one day I started, asking her if maybe her husband would be open to having just a diffuser in his office. And we just kind of went from there. And that's where, I started sharing with him using the oils in his office. And now Deep Blue is something, his massage therapist, all of them use the oils. And that's a much smaller scale compared to what we're talking about in the hospital and clinic setting. But it can start that way also.
But you do the same thing with your pediatrician. I know that you've given
Right.
her samples of hand sanitizer made with On Guard, and every time you see her, you're sharing some oils with her too. And there's some wonderful doTERRA literature on sharing in dental offices, which I haven't done yet. I haven't had my dental appointment, but I need, next time I have my teeth cleaned, I definitely will be taking that in, because I think that that's pretty exciting research related to the dental community, and that they would appreciate that.
Whenever I go to the dentist, whether I'm taking my children or going myself, we're always bringing that 10-pack of those On Guard samples, and I just leave them there. I don't really sound pushy like, oh my goodness, you have to try it. But your dentist sees your mouth and they know like, wow, your teeth are looking really great, or your daughter's teeth are looking much better than last time, and they know what you're doing. So the tear sheet that we're talking about, you can find it on Aroma Tools, and that's a really great tear sheet to use. So maybe just leaving that packet of those On Guard toothpaste samples with a couple copies of those tear sheets. And you don't have to, request a meeting or anything that way. They're going to contact you if they find it interesting.
Cori mentioned having, diffusers and loaning those out, and I do have a diffuser at work, and if we're having a meeting where I'm expecting things to be pretty stressful, I will get my diffuser out and put an appropriate oil in there. And, I do check around to make sure that people don't mind in case they are sensitive to aromas. And, mostly I've had 100% positive feedback on doing that. Having that diffuser in my office, though, I've had physicians come in with complaints. They want to talk to me about a concern or a complaint that they have. And I've had them look over at my bookcase and say, is that a diffuser? And sort of then start talking to me about what oil would I recommend for this or that for a patient. And pretty soon I was able to recognize that they were talking about themselves. And I ended up, having them leave my office with a bunch of doTERRA samples. And since then, he has been referring patients to me. And you have to be, of course, very compliant with that and not, share any protected health information. He never gives me a patient's name or any other information about them. He will just contact me and say, I have a patient that I'm sending to you. She'll probably be calling you. And so then I can get in touch with that patient. But, he's very careful to not violate any type of HIPAA violation or privacy violation in that kind of a circumstance.
And we were talking also about, just how physicians talk and relate to another physician more of, would you explain that more, how you kind of feel like that relationship is?
Right. I feel like the physicians are going to take recommendations much more from another physician. And, they love research. So any research that you can share with them is going to be better than none. But any research that you share, they're typically going to poke holes in it. So I would expect that, if it's not published in the Journal of American Medical Association or something like that, they're going to really be suspicious of it. But it really is helpful physician to physician. And I hope that at some point doTERRA physicians and chemists will be able to reach out to the medical community and really share with them how wonderful these products are. On my side of things, I'm a member of the American Organization of Nurse Executives and also the Northwest Association of Nurse Executives. And those are organizations where I feel like, I can really share with other nursing professionals about the oils. There's always so much emphasis on how stressful healthcare is, and working in healthcare is a really stressful job. And we're always so busy taking care of patients, but we're never very good about taking care of ourselves. And I think that that's a real avenue to approach professional organizations. And there's a professional organization for every nursing specialty. There's an emergency nurse association. There's an association for operating room nurses, one for women's health and neonatal nurses. And those are both national organizations. And then they usually have state and local chapters. So if you wanted to approach them and talk about reducing stress in the workplace, again, I think that Vanderbilt study would be a really nice way to do that. I just went to the conference for the American Organization of Nurse Executives, and our keynote speaker was really talking about depression in college students and how you really have to work very hard for 30 days doing the same thing over and over to make that a practice in your life for change. And it was just really sad to hear how depressed some of the college students are and how they end up committing suicide. And to me, it would have tied in very nicely had they had more talk and more information about how to use alternative therapies like essential oils and aromatherapy to help combat depression and help people to, uplift their mood and uplift their spirits.
Right. Support a healthy mindset. Yeah, healthy mood, definitely. And I think that one day soon we will be there. doTERRA will be there. We're going to keep pushing right along, and hopefully next year we'll have a booth at that convention, which is really exciting. Even the opportunity this year, we were open to attending there, and it just didn't work out for us. But next year, that's a big goal for our team personally. So I think one question also is when you're sharing oils, and do you invite people to a healthcare specific class? I think that if you have people that are interested in coming and learning more. You kind of tailor that class to them, obviously, but most people who are new to essential oils, they really want to hear an introductory class. If it's something where they've already been using the oils and maybe a platform like what we're talking about tonight, then tailoring that class to like we talked about, those studies and using that wellness in the workplace tear sheet. But I think just always starting simple. I think that's the biggest thing about this, is keeping it simple, right? Listening to the needs of the people that you're working with is always the number one. Another approach too is that, like Rhonda had said, there's lots of opportunities at the hospitals where you can show support for those staff. And so like the Nurses Week that she talked about, the bazaar. And really, I think it's pretty simple to try and participate those, right? Do you just...
Right. I would just contact Human Resources or the Chief Nursing Officer or whatever department you were targeting. If it's a Imaging Week, then I would contact the Imaging Director. If it's the Laboratory Professionals Week, I would contact the Laboratory Director and say, I would like to do this for your staff. And I would bet they would have a hard time saying no, because we really love it when people help recognize and honor the professionals that we work with, because we get a lot of complaints. We don't get a lot of compliments. You know, we hear more when people are unhappy than when they're happy. And so that goes a long way.
Oh, yeah, I'm really excited about Nurses Week, excited to share the aroma touch technique with them. And like we said, you know, we'll have a spot where if they're interested in, after their aroma touch, if they're interested in having a wellness consult, just keeping it really simple, and then offering them at that point, you know, we have classes. If you'd like to attend a class, here's the next available class. Or if you'd like to, you know, have a more in-depth one-on-one wellness consult, this is what we can do. And people are really open to it. I mean, we say this all the time, that people are tired of being sick and tired. And this is just another avenue. And, you know, it's so easy to share. And when you're sharing something that works, it's that much easier.
Yeah. I think one of Cori's most popular classes has been her mother-baby rollerballs make and take. And there's always pregnant women and new moms and babies out there, and they love having that support and having other moms share with them. So that's a really popular thing, and I think that we could definitely build upon that in my hospital, because most hospitals, if you're delivering babies, you're going to be having prenatal classes, and so that would be a wonderful addition, I think, to after you've had your Lamaze class. How are you going to manage postpartum with postpartum depression, or what essential oils might help you during labor? And I don't know if any of you are familiar with the book that Stephanie Fritz has written. I love this book. Hopefully you can see that book. It's filled with information about oils to use in labor, oils to use postpartum, and what to use for postpartum depression. And it really is just a fabulous book that I usually give to people. It's only like $14.95, and I try to keep a couple of copies on hand and give them to people with some sample oils to use.
Yeah, if you're giving someone a book or an A to Z guide, there's always a sample attached, right? And I agree, that's a really great idea to have, and I don't know why I haven't done that with the Lamaze classes. Like, yeah. Oh, you know what? Now we're offering how to use essential oils in the birthing process, but now I'm going to.
Yeah, and we have several new midwives in our community that, you know, I think reaching out to the midwives in particular, they would love to have this book and to have some sample oils for them to use with their clients. So it's a good thing.
Yeah, we had a great group of midwives start in Ellensburg, not far from where we are here. And I had just sent them a complete set of the Babies and Mamas roller balls just to get them to try it, and no strings attached, and some information supportive to that. I could have sent them that book as well, but I didn't.
Next time.
Yeah. So one thing is, we're talking about this, is if essential oils are covered by insurance, or if you can use your health savings account to pay for those kinds of things. And do you know very much about that?
I think that will vary insurance plan to insurance plan. I know group health here in Washington State is very, liberal and very proactive as far as alternative therapies and covering like massage therapy or acupuncture or aromatherapy. So they might be covered under that. But usually for the health savings account, you're having money pulled out of your paycheck on every payroll, and then you just have to submit receipts or just tell them, this is, I had an expense of $100 and I want this to be reimbursed. And there's usually not a check and balance on that. It's sort of a trust factor. I did look up to see from the IRS what was an allowable medical or dental expense. And there was an IRS publication number 502, and it tells you what types of prescriptions can be claimed on your tax benefit. In looking at that, I didn't personally think that the oils would qualify, but you would probably need to talk to your tax accountant about something like that.
Right. I guess, do you guys have any questions that you want to just chime in, and we'll just kind of go for there. The list that we had, we pretty much covered all of those. The best way to enroll a physician or healthcare professional, we had a call from corporate last month, a leadership call, and they did say that around the time of convention, we will no longer offer a preferred member. But up to this point, that would be the way that I would enroll them probably. The benefits are a little bit different than having a wholesale membership as a wellness advocate. But I think that that'll all be changing after convention. So that would really just kind of be up to you for now. I think that enrolling them as a wholesale member would be just fine for the time being. And they will appreciate that as soon as they get on LRP.
Okay, so we have a question.
You can just click on it.
Okay.
Yeah.
Can nurses wear the scents while on shift? That's in my hospital, I would say probably not. We have some pretty strict restrictions in the workplace on being able to wear colognes and things like that. So for most of the essential oils, I would say no, they probably could not wear it. And I know for myself, I was a little bit skeptical about people being allergic to doTERRA just because of the way I've heard how they process things and how careful they are. But I did actually, at work one day, I was taking a class. I wasn't around patients, but I was taking a class, CPR class, and my instructor, as soon as I walked through the door, she asked if I was wearing patchouli, and I had 1 drop of patchouli and a whole lot of fractionated coconut oil that I had rubbed on my legs, and I had on leggings and socks and boots, and she was able to smell that, and she did end up, having an asthma type reaction, and I felt horrible from that, just from the patchouli. So most healthcare organizations will not allow you to wear cologne at work.
Right. So the classes that I have taught to people that work in the hospital setting, that is absolutely what I hear all the time is, well, we aren't allowed to wear any scents or perfume. And so that's really when we start talking about, internal use. And that's pretty much the only route for that. Another question is, what is the Vanderbilt study? So the Vanderbilt University had published a study that they went around. They had taken, they had asked their nurses certain questions, hospital staff, and surveyed them about the way that they felt. Here's a couple of questions. In the past week, how often have you experienced work-related stress? And this was before the introduction of using the essential oils. How often do you feel overwhelmed in the workplace? And so if you look up the actual study, I think that even if you went to YouTube and typed in Vanderbilt hospital, you would find it. But here's just kind of a graph of what this looks like. And it showed all kinds of amazing outcome after the essential oil was introduced. And I think that they used wild orange, I believe.
Yeah. They have a list of oils. This was one where I mentioned going through your nurse practice committee, and I believe that that's how Vanderbilt did it, is they went through the nurse practice committee, and that they decided that they wanted to do this as a research project on how could they potentially reduce stress in the workplace, and would there be certain oils that they could diffuse that would cause decreased stress in their staff. And so it looks like they use lemon, orange, lime, grapefruit, and then a citrus blend.
Citrus
bliss. Mm-hmm. So that's typically what they were using in that study. There's another question, any possibility of being allowed to use oils on patients while in the emergency department or on the floor, and would you need orders for that? And then I would say that, again, I would take to your nurse practice committee to see if they could work with the physician staff and get permission for you to diffuse the oils to see if that would have a stress reduction in the workplace, not just for the staff, but also for the patients. And I would approach that as a research project if I was going to try to do something like that. I think that having the nurses do that research and promote it themselves would be much better than anyone else.
As far as using, the doctor actually using the oils on a patient in the hospital setting, I know that they are very cautious right now. And I think that that's something that the patient would have to have. So if right now, as of today, the patient would have to have their own oils
and asked to use it.
And asked to use them.
And certainly my hospital wouldn't prohibit that unless there was any type of a contraindication. And some of the oils do have some contraindications with certain medications. So they would allow the patient to use their own oils unless there was a problem.
I know that during the birthing experience with my son at our hospital, my nurse, she uses the oils herself, and they were very open and supportive to me having a diffuser, using the oils on myself during labor. And then, within minutes after the baby was born, I was using oils on him, and they were, it was all very new to them, but they were very supportive.
Right.
So I think it's kind of just, from varies hospital to hospital and physician to physician.
Right. And my niece delivered at Swedish Hospital in Seattle, and she also used essential oils during her labor for to help with discomfort, and then also to help prevent bleeding, and just spray afterwards to help her heal. And they were very receptive to allowing her to use those.
So this question is: so how would you help a nurse with a headache on shift?
Okay,
so you have lots of experience with this. This is kind of Rhonda's thing.
I do. I think frankincense is one of my very favorite oils. I think that it's really helpful for people who are having a headache. It just really can help them reduce some of the symptoms that they have and help them to be able to cope with it. And so typically how people would administer that is by putting it on the roof of their mouth and usually at the nape of the neck and on their temples. I have found that to be most effective for people who have just a common headache. And it's usually gone very quickly after that, certainly much quicker than ibuprofen or Tylenol. And I always give them, I keep a lot of frankincense samples in my little doTERRA emergency pack, and I will send that home with them so that if they have continued, headaches like that, that they can try it.
So basically, I think that, when you're there, if you already work in the hospital setting and, your coworkers or something like that, there's some questions here that are going to be a little difficult for us to answer because of compliance. And so, like, which one to prevent bleeding, that's one we just can't really answer. We can help by saying localized blood flow and support coagulation and circulation. And so if you have a copy of a Modern Essentials book, that would be where I suggest that you go and look. But I think which one helped with localized blood flow? So we want to stay very compliant here. I'm going to, off the subject of that, say I love helichrysum. It's in my first aid kit everywhere I go. And that's a great oil to have. So if you have, a little keychain that you keep samples in, something like that, It's so easy that if you were at the hospital or, seeing your doctor and your nurse just said, oh, I just have such a headache or I'm feeling stressed or something, that would be a great opportunity for you to be like introducing the oils in a really relaxed way. Have you ever considered trying an essential oil? They work really well for me and I'd be happy to share. And once they see you have a keychain and you really are ready to share, then they don't feel so bad about accepting that sample. I keep lots. I basically travel with every oil sample. They make multiple of them. And I think most of us wellness advocates do, especially if you're, participating in this webinar. Clearly you're interested in sharing. So always having those samples on hand is really important. So I think that,
questions?
Yeah, any other questions? I think that's pretty much all that we had to share so far. If you, feel that you have more questions or something like that, you're always welcome to reach out to us any other way other than this platform on a webinar. I'm always happy to help, and I know Rhonda is too. Yes. So thank you so much for joining this webinar. This was a first for us, and I hope we answered your questions and did well.
Thank you. Everyone have a great night.
Thank you. Good night.